Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and this video is for you if you have some type of back, butt, and or sciatica pain, and you are unclear about the motions that make you feel worse or the motions that make you feel better. Maybe you feel like it's just hard to nail down what really aggravates your issue, or maybe symptoms are just there kind of at baseline. It doesn't really matter what you do. All right. So for those of you who are new to the channel and you don't know me, again, my name is Dr. Charlie. I'm a physical therapist. I have my board specialty in orthopedics, and I help people with unresolved back, butt, sciatica problems learn to fix themselves using the power of the mind and movement as medicine. So a couple questions just to make sure that you are in the right place. Have you ever gone to see a specialist and felt like you had to make something up to convince them that your pain is real? Maybe they were bringing you through some different tests and you're like, gosh, like that's not really doing it. It's not really recreating the pain that I experienced. But if I don't act like something that they're doing hurts, right, then maybe they're going to think I'm making it up. Do you yourself sometimes feel even a little bit insecure or confused and frustrated by the inconsistency in your pain and the pattern in which it presents itself? Are there good and bad days or days where you just feel like, man, this really doesn't make a whole lot of sense. I just can't nail this down. We can't figure this out. Do you have trouble consistently reproducing your pain with specific movements or tests, again, that puzzle you and or your doctors? And this is why nobody can agree upon what's going on. You keep getting test after test to try to figure this stuff out. And do you know that feeling, right? When you've gone to the car mechanic, your brakes are squeaking or something's going on there, right? And then they test drive the car and nothing squeaks. You know that kind of like embarrassment, right? And or that scratching your head kind of feeling of like, I swear something's wrong with my car. And they're like, well, I'm not seeing it, right? And so this video is perfect for you if you've resonated and or said yes to any of those questions. I get it. You're not alone. I hear this every single day. You are not crazy and your pain is very real. All right. So understand the absence of a clear pattern is the pattern. So many times in medicine, right, we try to put you in boxes. It's like, okay, if you have boom, 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 this is this, right? If you have boom, 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 this is that, right? But not being able to identify and kind of having this confusing pattern is the pattern. Just because you don't understand what that pattern means, and just because you're confused by it and other doctors are confused by it up to this point, hopefully I cleared that up for you in this video, doesn't mean that there's no reason for the pattern. That pattern doesn't mean anything. Okay, the absence of a clear pattern is the pattern. All right, so in this training, you will learn a simple but powerful 6 sort of step total body scan. I'm amazed at how many people have seen lots of different specialists and actually haven't gone through a consistent movement exam, haven't been thoroughly evaluated. All right, so we're going to keep it simple and walk you through some basic movements you can do to determine, is there consistency or is there not within your movement exam. I'm going to review 4 quick case studies of people who I've worked with and or people have reached out to me who have had trouble sort of proving their pain and finding motions that clearly made things worse. And as you can see, it ends up causing a lot of frustration. I want to help you make sense of a movement exam that makes no sense. What does it mean, Charlie? What's going on, right? Why is it nothing adds up? Why is it that you're frustrated? Why is it you, doctors and specialists, are still confused, probably after you spend a ton of time, energy, and money working with them? And what does a mismatch between yummy movements or movements that feel good and yucky activities really mean for you and your recovery? I know this maybe doesn't make sense, but we'll clear everything up as we walk through. So stick around. All right. So for some people, as I alluded to, when you hurt, why you hurt, what makes you hurt, what makes you feel better, what makes you feel worse is clear as day. Right? For other people, and probably people watching this, it's clear as mud. All right. It's hard to find a consistent pattern. It seems like nobody can agree upon what's going on. Symptoms are all over the place. What is happening? And so every day I get emails like this from people maybe like you. All right. Just got this a couple of days ago, right? At the time of shooting this video. Just did your 6 tests, Charlie. They didn't trigger anything. My pain moves about and is worse at rest. I don't really know what's going on. In fact, this person can do lots of activities, swimming, biking, hiking, all this stuff. But symptoms are just there. They can't really pinpoint what's happening, and neither can anybody else. Or I get comments from people like this who start working with me and are yet to understand the process. This is like day 1 comment, right? Can't find painful motions. Am I the only one who can't seem to experience pain from any of the motions in the total body scan? Again, we're going to go through this to see if you can resonate or relate to this. I only feel pain while lying down. Positions, that's all for me. I just can't seem to pose without pain, but motion, not really a problem. Is this weird? You'll see it's not weird. It's weird to this person. It's not weird to me, and it won't be to you after watching this video. Should I just fill in the motion slots on my worksheet with something random for now? And here's what you'll see. People like this, they'll actually go through the total body scan. They'll actually put some type of response there. They'll say, well, that motion actually, maybe it did hurt. Well, maybe that, and they'll kind of grasp for straws because they feel like if I can't find something to show someone that this hurts, then they're going to be confused and they can't help it. That's not true. All right. Even if you cannot find consistent motions that make you feel better or make you feel worse, it doesn't mean that we can't help it. In fact, it most likely means that we can help you. It's just, again, the absence of a clear pattern is the pattern. And luckily, there are people out there like myself who understand that. Hunting for motions difficulty. So inside of the private coaching program, again, I work with people all around the world with these issues. I have people go hunting for motions, testing different motions to find what's going to work for them. But this person's confused. I can't find any painful movements to consistently appear. It is impossible to hunt when there's no consistent pain in which to test and then retest. I have a very difficult time picking my top 3 yucky motions to begin with, given the same problem. When initially doing the total body scan, which again, you'll do here in a moment, it was also very challenging as the pain is not always there. Symptoms are all over the place. Can't find yucky motions to record. I'm doing the healing log for the first time, and I can't find any yucky motions to record. The only thing that seems to cause my pain is when I sit, just sitting pain. No other motions I can find at this time. Is it okay to not have any yucky motions? So again, people feel like can I put that nothing bothers me? And they feel like, again, like embarrassed or almost like an outlier, and like we're not going to be able to help them, but we can. There is a process that you can go through to understand what's going on and get the relief that you've been looking for, even if you've had this for a long time and are confused. So let's walk through again this total body scan. We'll do this very briefly. You can always go back to this video if you feel you need to kind of rehash some of this. But again, I am just always surprised by the lack of physical exam that is completed on people who are in pain, especially after seeing many, many physicians. Many people allude to the fact they haven't actually gone through a complete movement exam. So this is a movement exam that I developed. Very simple. It doesn't include every single motion, but we're going to work through it. Okay. I use 6 motions to assess different areas of the body, which picks up on very common problems in most cases. So the purpose of the total body scan is not to flare you up. Just a disclaimer here. It's simply to help you explore, or us explore, how your body responds to motion. To get an idea of when I do this, what do I feel? Does it feel good or does it not feel good? Do not push through pain. If you do not feel comfortable doing this, don't do it. It's okay. Get the concept that I'm trying to teach you. So how do you perform the total body scan? 1 rep of each motion, 1 at a time. That's it. Let's keep it really simple. And you would literally just record the motions that you're going to do as either yummy or yucky. Put a smiley face, put a frown face next to it. It has to be clearly yummy or yucky. Quick distinction here. As a rule of thumb, yucky motions are motions that reproduce your specific pain or problem. Motions need to reproduce your specific pain or problem. If a motion doesn't clearly make your pain worse, we call this yummy. If it does, we call it yucky. Also, one final note here, because a lot of people have questions about this. If you have some pain at baseline, let's just say I'm sitting here right now and I have a 3 out of 10 on the pain scale, then a yucky motion is a motion that worsens your symptoms above the baseline while performing it. So if I have a 3 out of 10 right now and I do a specific motion and it just keeps it at a 3 out of 10, that motion wasn't yucky. All right. You just feel yucky at baseline. All right. Again, listen to that again if you need to. So now let's go through each of these motions, 1 rep, 1 at a time. Start by taking a seat and twisting your trunk to the right. Your legs can do whatever they want. Your arms can go wherever they want. You're literally just going to twist your trunk to the right and record yummy or yucky. Twist your trunk to the left. Yummy or yucky. Again, feel free to slow this down. Go back and do it. Next, pull your right knee to your chest, just like you see here. Is it yummy or yucky? Then pull your left knee to your chest. Is it yummy or yucky? Again, some tightness, some pulling. This stuff is normal, but does it reproduce your pain, the sensations that you experience? Next, we're going to do a little figure 4. You don't need to crank into it. Just literally bring your knee up and let your leg fall out. Yummy or yucky on the right side. Figure 4 on the left, do the same thing there. Yummy or yucky. Next, just go ahead and relax back in your chair. You don't need to sit up tall. There's no right or wrong way to do this per se. Just straighten and lift your leg up. Straighten your leg, lift it up. Yummy or yucky? On the other side, again, relax in the chair. Start with the left leg straight, heel on the ground. Lift it up. Yummy or yucky? Now, moving the body forwards. So just try to bend forward. And again, if you don't feel comfortable doing this, you have something, you have brittle bones, or you have something else that says, hey, I don't want to do that. It's totally fine. Don't force yourself through anything, okay? Yummy or yucky? Put your hands on your right knee. Bend forward over top your right knee. Yummy or yucky? Now the left side, yummy or yucky. Finally, we're going to explore backwards. Stand on up, bend straight backwards. Yummy or yucky. Keep your balance, spread your feet apart a little bit if you need to. Now for this one, back to the right, what you're going to do is you're going to stand there, twist your trunk to the right first, and then bend straight back. Yummy or yucky. Same thing on the left side. So stand, twist all the way to the left, and then bend straight back. Yummy or yucky. And that's it. That's the total body scan. All right, so as you went through that total body scan, did you identify any clear and or consistent yucky motions? If you had to do a motion 10 different times to see if it was yucky, it probably wasn't yucky. All right, it should be very clear. We're not talking about splitting hairs here. If so, be sure to check out my Better Than an MRI DIY diagnostic guide. I will link it above. Basically share my entire diagnostic framework for figuring out the cause of your back, butt, and or sciatica pain. Or were you a bit confused? Were you left kind of scratching your head being like, wow, man, there's motions. I mean, I feel a little tightness. By the way, everybody feels a little tightness or stretch or pull or whatever, but it didn't really reproduce my pain. So were you a little confused like this person? I found it not the easiest thing, right, to go through this motion process because I was feeling some back pain before it started. And I don't think it was from any specific movement, or if it was, I'm not clear on what it was because it was in the morning. So it was a bit difficult to differ movement pain from just existing pain. Also, as I was going through looking for the treatment motions, or as she was moving her body, it was sort of unclear if it felt yummy or yucky. Sometimes I feel like my pain is just there regardless of what movements. And other times I feel like I can actually track it better. It's frustrating, but I think I managed to find movement that did help the pain. All right. And so this person needs a little bit of coaching, a little bit stuck, right? And that's totally cool, right? But you can see and just sense the frustration and the confusion. They're sort of all over the place. They can't clearly identify, even after going through all these motions, what makes them feel better, what makes them feel worse. And that's okay. It's actually very normal. In fact, over 50% of the people that we work with have a hard time identifying clear, consistent patterns within their movement-pain relationship. So look, I'm going to break it to you, all right? A problem that is reproducible with motion is almost always reducible with motion, meaning people who have a physical structural problem, an issue within their tissues causing pain, show consistency within their movement exam. They're not confused at the end of this. There was no question, when I did this, Charlie, it hurt. And doesn't matter if I do it in the morning, doesn't matter if I do it at night, doesn't matter if I do it tomorrow, doesn't matter if I do it when it's sunny or when it's raining or when it's snowing or anything. When I'm sad or when I'm happy, when I do this, it hurts. Their yucky motions are clear, predictable, and consistent. If all your motions are yucky, let's just say you did it, man, everything hurts, then you've either just injured yourself, maybe you bent over, you picked something up, and everything's really nasty, acute pain, inflammatory process going on there. Or you may be experiencing what we call central sensitization, essentially a hypersensitivity of the central nervous system. We'll talk a little bit more about this in a moment. But on the other hand, if no motions clearly reproduce your pain, the pain's just kind of there, doesn't really get worse, doesn't really get better. It's like, okay, I went through all these and again, wasn't clearly yucky or yummy. If all motions are fairly yummy, then this is inconsistent with a structural cause of pain. This is not how structural injuries and or issues within your body's tissues, disc problems, joint problems, bone problems, it's not how they respond. Broken bones, injured tendons, herniated discs, angry nerves. They don't hurt one moment and feel fine the next. They don't hurt one day and feel fine the next. 1 hour and feel fine the next. Instead, they follow, again, a clear, consistent, predictable movement-pain relationship. So I want to hammer that home. And this total body scan, while it's not fully complete, and there are other motions that we scab on and help people figure out here, it's just a really quick screening process. I've worked with over 10,000 people with back, butt, and sciatica pain, and it's designed to stress the joints, the discs, the muscles, the nerves, right, of the hip, of the back, of the leg, and other tissues within this area in many different directions and from, again, many different angles. Again, it's not all-inclusive, but it does a pretty darn good job. If you have a structural problem in your hip or your back, it's going to cause some ouchiness. It's going to very clearly be yucky. It's going to be consistent. It's going to be predictable if it's a problem structurally within your body. Right? So a problem that is not clearly reproducible with motion is not likely a motion problem. And this is why you're stuck. If not a motion problem, Charlie, what could it be? What do you mean? The mind. This is fascinating stuff. The reason many people in pain have trouble reproducing their pain or finding consistency in their movement-pain relationship. They have trouble finding consistent yucky motions, motions that make them feel worse, or even motions that make them feel better, is because the mind is at play. And in this case, the pain is very real, but the mind, not the body, not the disc, not the piriformis, not the SI joint, not the hip, not the sciatic nerve, nothing is creating the pain experience, or at least part of it. The mind is at least involved in part of it if you're getting these confusing, conflicting responses to movement. The thing is, most doctors know nothing about this, all right? And so anything that feels very physical, just understand it could be caused by the mind. And aside from trouble identifying clear and consistent yucky movements, I want to take this another step further. There is often a mismatch between the movement exam and the pain people experience, which makes no sense. It just doesn't add up, right? You can see that in some of those posts. This gives further evidence that the mind is driving the symptoms. So again, let's take this one step further and kind of explain what I mean here. And we'll do this by reviewing some case studies or some examples, okay? So this person posted this in the beginning. Can't find yucky motions. I'm doing a healing log, can't find any yucky motions. Just hurts when I sit. No other motions bother. What's going on there, right? You can see the confusion, the questioning. This person has trouble sitting. This is an activity, if you will. They go through their total body scan, or they go through their own motions, and they say, hey, Charlie, I can do all the things that make up sitting. I can bend forward, center, to the right, to the left. I can pull my right knee up, my left knee up. I can do these figure fours, right? A little tightness, but it doesn't really cause a problem. I can do leg raises, right? Nothing's really clearly yucky. I can do all these things, but I can't do this. That's weird. That should make you think, huh, that's kind of funky, because sitting is those things. So they can do yummy isolated or individual motions. And when they put them together, they can't do it. They have a yucky integrated activity. And this is a sign, one sign. We don't just take this one sign and say, hey, mind is causing pain, but this is one piece of evidence that, hey, something's a little funky going on here. And if things are weird, they're usually wired. Remember that. Sitting is a knee to chest and a forward bend combined. So how is it that you can do both individual or isolated motions and they feel yummy, no pain, but you can't sit? Again, something's not adding up. Another example. This person, they go through, right? By the way, I had to coach them through this because they went through and they were like, oh, that's yucky. And I was like, well, what do you mean? And they're like, well, it wasn't really yucky. It's just like I felt like I had to put something down there because, like, how can you help me if I don't have any yucky emotions? It's like, no. Don't josh the system. Work through the process. It's okay. Yummy, 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 yummy. Lots of yummies. All right. They can do all these different motions, but they can't run. And like, that's weird. So what is running? Running is leg raise on the right side and the left side, but that's yummy. Running is a kickback on the right leg and the left leg. Running is a little bit of a back bend. Running is a twist right, a twist left, or an arm swing right, and an arm swing left. And probably knee to chest, right, on one side, and knee to chest on the other side. It's kind of all these different motions. Oh, and hopping on the right leg, hopping on the left leg. How is it you can do all of these things individually, and they're pain-free? But then you're saying you can't put it together. And you can apply this concept anywhere else in the body you might be experiencing pain. Right? So this person, they can bend backwards fine, all different directions. They can raise their right arm, they can raise their left arm, they can look up. This person reached out to me and like, hey, by the way, that's looking up and that's raising your arm. And they're like, man, when I clean windows, when I go to work, person cleans houses, I can't do it. When I get home, I'm okay, but when I go to work, I can't do it. Doesn't really make sense. It's like saying, all right, one final example. It's like saying, hey, I can raise my arm up overhead, but I can't grab the mug on the top shelf. That would be weird, right? All right, so what could explain someone's ability to perform individual yummy motions, but an inability to then tolerate integrated activities which are made up of those yummy motions, which they have no trouble with? What about this? This person, when they go to work, or maybe when they're at home, right, they're stressed out. Maybe it's the end of the day and they're like, man, they're tired, they're exhausted. Maybe something else happened with their relationship. Maybe they're a single mom. They got a lot going on. And they're taking every ounce of the effort or energy within inside to just clean the windows. Just got to get the windows done. All right, and they're stressed out. This person, let's just say they clean windows and they work for maybe someone else, or maybe even they work for themselves, right? Maybe they're just doing it to get by and they're like, wow, I hate this job. And so negative stressors and or emotions associated with this activity. Maybe this person works for someone else and they're like, man, I just can't stand my boss. This is like the 1,000th window I've cleaned today and I'm barely getting paid anything to do it. Maybe there's a lot of stress there and a lot of tension at work. What could explain this person's ability to do all this stuff and feel totally fine, but then when they engage themselves in the experience of running, they can't do it? Well, if they're a runner, running is their life, running is their identity. Maybe the stakes are so high and they just feel like, man, I've got to be able to run. I can't lose this. And so they're running from a place of fear, trying to hold on to that which they identify with. Or maybe this person has an upcoming event. They can do all these motions, right? But there's a lot of pressure around their ability to perform. I worked once with a soccer player, young soccer player. When he played soccer for fun, he was fine. When he played soccer competitively, it became all about winning the medals and getting to the next level. And his parents put a ton of pressure around him. Soccer became painful. He could run totally fine outside of soccer, but as soon as you put a ball in front of him, he couldn't. Not a structural problem. That is the psychology of pain at play. What about this person? I only have pain when I sit. I can do all the motions which make up sitting. I have all yummy motions, but I just can't sit. Quick story of a lady who had pain just like this. She developed pain while sitting, while driving hours to and from her dad's house, who had just passed away. And so she blamed the sitting and the posture and the physicalness of sitting and the act of sitting and how that stresses discs out and all that on why she hurt. But really, she developed a malassociation and or an emotional connection, which was negative to that experience of sitting, because it occurred when she was going to deal with her dad's passing. Really interesting stuff here. If you're not working with someone who's sharp and understands the mind and the body, we'll overlook it. Psychological stressors and or danger signals, that's what they are: anxiety, fear, worry, concern, all these different things, can manifest as physical sensations or experiences. You could be watching this right now and say, Dr. Charlie, it's right here in my butt. Are you telling me right now? And the answer is yes. I'm telling you right now that it could be your psychology at play. It could be your mind. Doesn't mean it's not real. We can actually learn to associate physical activities with pain. This is just what I was talking about in the last example of the woman sitting. And we tend to blame these physical activities as the cause of pain. I call these things perceived injuries, when in actuality, it often has nothing to do with the physical activity. That's just what we've linked it with. And everything to do with the belief that the physical activity is harmful or threatening in some way, or some negative association with it. And this, again, doesn't mean that it isn't real or it's all in your head, because I get so much backlash about this. So many people just aren't aware of this stuff. If you feel your pain, then it's probably real. And so it is real. Otherwise, you wouldn't be here, right? But it is possible your brain has become hypersensitive and is making a bit of a mistake. In fact, you have a very good brain. The force is within you, all right? You've got a good brain. It's just that most doctors don't understand enough about the mind and the body to connect the dots and pick up, again, on these kind of inconsistencies within the patterns. They don't ask the questions. They look at the images and try to treat the image. They don't treat you. And so as a result, you're tossed around between specialists and fall further down what I call the healthcare rabbit hole. And because of this ignorance and or not knowing, on your part, yes, but it's not your fault, but really on the doctor's part and the medical profession as a whole, you may just be dismissed. Again, you might feel embarrassed and frustrated, or given all kinds of different random reasons for why you hurt. And ultimately, again, you're given random reasons, you're given random treatments, which ultimately don't work. Why? Right? Because they're focused solely on treating the body and are blinded to the role of the mind on pain. They just don't know how, again, to put everything together and make sense of this for you and then for themselves, such that they can design an effective treatment program. So essentially what's happening is they're missing the boat. All right. 95% probably or more of the medical community is missing the boat. Because pain is an experience created by the mind and the body, it's virtually impossible to resolve pain long-term using treatment that focuses solely on one or the other, but rather we must adopt an approach which appreciates both. Of course, this is my opinion, all right, but I've seen firsthand the value in understanding both sides of the coin, not just one or the other. Because this is the pain experience. If you're watching this, you're probably stuck in what we call a negative feedback loop. This is how I describe it, right? It's this interaction between the brain and the body, and not necessarily in the way that you would hope, all right? So it could start with either the mind or the body. Let's just say that you move a certain way. It hurts. What does that tell your brain? It tells your brain, hey, movement is bad. Don't do that thing. Become a little bit more fearful or worried or concerned. And what does that do as far as the movement system? Move less. More fearful, worried, concerned. Move less. You become more fearful, worried, and concerned. Move less. More frustration, etc. right? And you get stuck in this negative cycle. Movement hurts. I'm afraid to move. You move less, more fear, more pain. Movement hurts. Boom, boom, boom. And this is you stuck in the middle. But by using positive inputs from the mind and the body, we have the potential to flip this negative feedback loop to a positive one, right? You give this time, you put in reps, and this changes your pain experience and ultimately extinguishes your pain. We get the body to move in a good way. You start to say, hey, that wasn't too bad. I can do that. As opposed to going to a traditional, say, PT or osteopath or chiropractor, where you're stretching, you're foam rolling, you're pushing on things, you're pulling on things, you're trying to strengthen things, right, that are painful. And then that reinforces your brain that you're not safe. Or if you go to someone and they say, hey, wow, your hips are all out of whack, you know, you're tilted this way, and oh my gosh, I haven't seen a back like yours ever. You've got the worst spine. Spine is that of an 80-year-old, even though maybe you're watching this and you're in your 40s, right? Just kind of that negative narrative. Well, guess what? That fuels the mind with negative inputs. You become more fearful, worried, concerned. You move less because you're worried about hurting yourself, worried about further herniating that disc or causing more misalignment or whatever you've been told. So move the body in a good way. We start to reduce the fear in the mind. The less fear we have, less frustration we have, the more we understand what we're really dealing with, the more we move. The more we move, the better we feel. The better we feel, the more we move, etc. All right, so hopefully this was helpful. And the entire goal of this training was to, number one, give you some hope. And then number two, right, let you know that you're not alone in the sense there are many people who reach out to us that have inconsistencies in their ability to reproduce their pain. Symptoms are a little bit funky and or things get a little bit weird. You might have gone to doctors and you might feel like you've been dismissed and or like nothing makes sense and nobody can really kind of pinpoint what's happening. That's okay. Again, you're not alone. I get it. It's not your fault. And there is a different approach, right? But it takes you kind of zooming out, helping you put the pieces together. Just because, again, you maybe don't fit in a box that someone wants to put you in, doesn't mean that you don't fit anywhere, all right? And so the absence of a clear pattern often is the pattern. By the way, if you're watching this, you are interested in learning a little bit more about the process that we use to help people like you with back, butt, sciatica problems all over the world, by the way. We don't just work with people locally, all over the world. Then be sure to check out, I'll put a link to a free workshop I created. Again, it starts to give you some tips, some tricks, and some understanding of how we might be able to solve this in a completely outside the box, different way. Thanks so much for watching. Let me know your thoughts in the comments.